Welcome and thank you for joining us today for the meeting of the New York City Health and Hospital Equity, Diversity, and Inclusion Committee. Today's meeting is officially called to order. Per bylaws, Section 14, committee attendance. If any member of a standing committee or a special committee of the board will not be present at a scheduled committee meeting, the member may ask the chair of the board to request that another board member, not a member of that committee, attend the scheduled meeting and be counted as a member for purposes of quorum and voting. Sally Hernandez Pinheiro has designated Erin Kelly, representing the Deputy Mayor Ann Williams Isom, to attend this committee meeting and be counted as a member of purpose of quorum and voting. This request has been approved. Next on the agenda, I would like to propose a motion to adopt the minutes of the Equity, Diversity, and Inclusion Committee meeting held in January 9, 2023. Any second?
Second.
Thank you. So I'm going to poll each member for his or her vote. Dr. Katz?
Yes.
Frida?
Yes.
Aaron?
Yes.
Thank you. So it's passed. Next is a diversity and inclusion update from Ivelisse Mendez Justiniano. Yes, thank you.
Good morning, everyone. Good to see everyone without masks, see everyone's face. I will start off today's report with the language access completions. So we have 23 English source documents that were translated into other documents. So what that means is that out of every 23 documents they were translated, we ended up with exactly 66 distinct translated documents. So these documents were translated in all these different other languages and made available to the staff. We also worked with our street health outreach and wellness vans, as well as our partners for working with over-the-phone interpretation and video remote interpretation services, so that now when we go out into the street, into the different communities, we are able to offer interpretation services to all of our patients. We also worked with Jacoby Language Access Coordinator and our language line vendor to add Jacoby to the priority list for over-the-phone interpretation calls. And what that means is that Jacoby will now have precedence when they put in a request for an interpreter, they will be given priority over non-healthcare agencies. So that's a plus for Jacoby and for our healthcare sites. When we move on to our diversity and inclusion training, our top training for the months of January and February were sexual harassment prevention, interreligious awareness for patient care, and strategies for fostering inclusion in the workplace. We had a total of 10,234 employees completing the training. And when you compare that to our workforce, the demographics in terms of gender, those identifying as female were 68%, male 32%, and non-binaries 0%, as well as unknown. It matches the percentage of people completing the training, because they were 67% female, male 30%, unknown 2.6, and non-binary 0.4. So the individuals taking the training match our workforce. Moving forward, we also added the essential documents to the essential documents directory. And so the adult social needs screening tool, the pediatric social needs screening tool, the parental consent to share child's information between the New York City Department of Health and Mental Hygiene, Early Intervention Program, and New York City Health and Hospitals. What this means is that now we have accessibility for staff to access these documents in the top 13 languages. And these are all available on demand. We also printed and distributed over 500 diversity calendars, and this is part of our inclusion strategy. We also conducted an internal review of LGBTQ+ content on the ODI insider pages and created a more user-friendly and accessible proposed redesign. So we are continuously looking to upgrade, make our site user-friendly and accessible to all staff. So we routinely conduct a self-audit and make recommendations to improve our site. We also are happy to announce that we relaunched our Pride Health Advisory Council meetings to in-person meetings. So throughout COVID for the past 2 years, we have been meeting virtually. We are now back to in-person meetings, and we are doing those meetings at different sites throughout the year. Under gender equity, We also held the the Achieving Health Equity for LGBTQ plus people workshop, and that was attended by 53 participants. We facilitated a live virtual training on February 13th in partnership with Hospital Police as part of the new employee orientation. This was attended by 34 staff. We had submitted the Long-Term Equality Index, the LEI, to the Human Rights Commission. They sent us over a request for additional information. We went back, we reviewed the information, we resubmitted the form, and we are now waiting for word in May. We're supposed to receive notice if we were awarded the LEI designation for New York City Health and Hospitals for our post-acute care sites. We are also getting ready for June, which is Pride Month. So we are now meeting all the facilities. We're meeting with all of the individuals that are champions for these events. We typically participate in every event every weekend during the month of June. And we have participation by all staff, all different staff at the different sites. So right now we're in the process of ordering the collateral and making sure we have participation and representation for all groups. We provided a workshop on achieving health equity for LGBTQ plus people. This was held on March 20th, and 33 staff members participated. We also provided a in-person Achieving Health Equity for LGBTQ plus people session. We held 2 of these. So one was on February 23rd, the second on March 2nd. And these were both held at Elmhurst, one for the pediatrics team, attended by 29 participants, one at Elmhurst, also attended by 29 participants. And this is important as well as we get ready to open our Pride Health Center at Elmhurst Hospital in the summer of 2023. System level achievements. On February 9th, we hosted Black History Month panel, which was entitled Racial Differences and Disparities in Healthcare for African Americans. This was attended by 148 attendees. On February 15th, New York City Health and Hospitals, we participated in the Diversity, Equity, and Inclusion Empower panel event. I participated on a panel with 3 other panelists. We had over 7,000 registered, and this was a unique opportunity to share best practices from New York City Health and Hospitals to other organizations. On February 28th, we also held a workshop on the impact of race in workplace dynamics, Race Matters. This was attended by 145 employees. So we have a good cross-section of employees that are participating in all of our events. In terms of communications, on January 17th, we acknowledged Martin Luther King. February 22nd, we acknowledged and commemorated Black History Month. March 1st, Zero Discrimination Day. March 8th, International Women's Day. And March 22nd, we also celebrated the holy month of Ramadan. And it is now my pleasure to introduce the awards that we received in the last board meeting. I presented that we had applied for international awards, and we did indeed receive 2 awards. We received recognition for the International Diversity Champion, and we also received recognition as an International Inclusion Champion. The designation comes from the Diversity Organization, which is the official awarding body for the International Inclusion Award and the Diversity Champion Award. And you can see on the slide, those 2 designations can now be used in all of our marketing equipment, our recruitment, and our signature pages to identify us as such.
Congratulations. Very great job.
And so we continuing on with the system level, and this is just highlights of some of the feedback that we received from the judges. They included solid evidence, the level of training and education provided, excellent recognitions for sustained commitment to LGBTQ+, evidence to support commitment to cultural and religious understanding. They also called out our D&I calendar, which uses photos of actual staff to celebrate the different events. That was direct judge feedback. And then we have ongoing projects. So when you receive recognition, you keep on going and you continue to try to improve. So our ongoing projects include the restroom signage project, which is ensuring signage across the system is up to date and compliant with both Law Local 79 of 2016 and the Gender Neutral Bathroom Law of 2021. We are working closely with our facilities management teams, going out to the facilities and making sure that the signage is up to conform with gender neutral guidelines. We held and we are continuing to hold mental health training in conjunction with the Institute for Human Identity. We are also moving forward with human resources training, which is enhancing communication using LGBTQ plus affirming health practices. And this means that when we address individuals, even though their name may say something, they may be wanting to be referred to as something else, a proper gender pronoun. This is learning how to communicate with individuals in that nature. We are starting with human resources because all the staff comes in first through human resources. Once we finish this department, we're going to move on to different departments throughout the system. In addition to that, we also have the Joint Commission updates. So we have a new Joint Commission update that was enacted and actually takes place now. It's in 2023. It applies to ambulatory care, behavioral health, and hospitals. And the standard is essentially reducing healthcare disparities is a quality and safety priority. This standard comes accompanied by 6 different elements of performance. They include designating an individual to lead activities to reduce healthcare disparities, assessing patient health-related social needs, identifying healthcare disparities, developing action plans, acting when you don't achieve the goals, and annually informing key stakeholders, including leaders, licensed practitioners, and staff about its progress. We are working jointly with the Office of Quality and Safety, as well as the Office of Population Health. Most of these standards, all of these standards, we're already in compliance with. Now it's just a matter of going in and putting it together so that it complies with the standard. And so on that, we have worked on a template that's going to be available to all the facilities to basically plug in what we're doing in response to this element of performance and this new standard. So that's the Joint Commission standard. This is an ongoing process. We'll be working on this throughout 2023. Now we have a unique opportunity. We have a grant submission that we're working on. There's a grant opportunity made available to us by the New York City Unity Project, which is the city's LGBTQ and interagency coordinating body. This is an offer in partnership with the Office to Prevent Hate Crimes, the Mayor's Office of Equity, and Destination Tomorrow. The grant is a capacity building grant, and it's essentially focused on training. The grant submission will be focused on affirming clinical care for transgender non-conforming adults. The training is also a prerequisite criteria for staff prior to the opening of Pride Health Center. So what we are looking to do is provide this training to Elmhurst Hospital, again, in terms of supporting them as they get ready to open their Pride Health Clinic. And then planning ahead. So right now we have several open initiatives. One is participation in the Mayor's Office initiative, which is student apprenticeships. So we are looking at providing opportunities to students throughout the city for underrepresented neighborhoods. And these individuals will be coming in for the 3 years during their high school. And what they will be doing is working in areas that are high need throughout H&H, but also will provide an opportunity to have them employed after graduation. So they will be with us for 3 years. They will be fulfilling our needs, but they will also be trained in the work that we need them to do. After graduation, we now have career pathways that were prepared for them, and they now will become employable by New York City Health and Hospitals. We also have completed a review of 7 LGBTQ online modules, and we're due to meet with our partner vendor, Fenway, to discuss the updates. And this is part of our continuous improvement initiative in the Office of Diversity and Inclusion to ensure that all of our training is relevant, up to date, and we maintain in terms of providing our employees with the latest information. And then ultimately, we are going to be introducing the Health Equity Roadmap Transformation Model. And the Health Equity Roadmap Transformation Model is essentially a roadmap that consists of 3 different elements. The first element is the Health Equity Transformation Model, which you see in front of you. It consists of 6 levers of transformation. And what this is a guide for New York City Health and Hospitals and other hospital agencies to begin their transformation and assess where they are in terms of health equity. This is in line and in alignment with our class standards, providing cultural and linguistically appropriate services. We have equitable and inclusive organizational policies, the collection and the use of data to govern our actions, and also to have diverse representation in leadership. It also looks at community collaboration for solutions and systemic and shared accountability. The way this works is that we, is in essence, sign up with American Hospitals Association, and then they provide us with access to an assessment tool, which we will now work in partnership with quality, with all the different areas within H&H to determine where are we in terms of achieving a health equity model. They will then be able to identify gaps, and then that will essentially provide our individual roadmap at New York City Health and Hospitals with how we can improve and in what areas we can improve with. So this is the first introduction that we have of this roadmap. We will begin to work with our different partners throughout NYC Health and Hospitals, leadership at the hospitals, at the post-acute, in Gotham sites, in order to ensure that we are essentially moving forward to transformation. And that completes my report.
Thank you. Thank you. I just want to make sure that if there are any questions from the board members, Dr. Katz?
No questions.
Erin? I have a couple, if it is okay with you.
Yes,
In terms of the private health centers, I know that in the past we have listed where they are going to be located and when they will be opening. And I believe, if I remember correctly, that there was one of the borough that didn't have any price center in the Queens.
It's Queens, and I'm happy to announce that we are tentative for June to be opening that Friday.
So in that case, we will have a price center in each borough. Is that correct?
No, I believe we still have Staten Island that we're working on.
Okay.
Right now, we're focusing on Queens, getting that up and running. As you can see, the majority of our efforts are focused on giving Elmhurst the support that they need, and then we will provide the next area where we move to.
Okay, so that's in the line. Okay, thank you. I really appreciate it. In terms of the Mayor's Office Initiative and Student Apprenticeship, have you worked with the radiology school? Gosh, I forgot the name. We visit them in Elmhurst. They have a very good system there. It's like a training program. I don't know if you have had any conversations with them.
We have not, but we are open to exploring that.
It's different. It's for radiology, but they have a very good system. They have been in a system for like 40 years or 50 years. So I would suggest that maybe there is something that it's definitely from the medical sciences. This is different, but I think they have a lot of things that may be quite valuable. And we visit them like a couple of months ago, I believe so. And last question, in your 6 levels of transformation, this area of collection and use of data to drive action, is this also related to some of the IT work on the dashboard, or is this something different?
It's all encompassing.
Okay.
So they will be looking at how do we connect data? What data do we collect? How do we use the data and to make the decisions that we're going to make? And it's also similar to when we look at the Joint Commission new standard, because it also includes a data element. So when we're looking at that data, we look at the population health, the maps that they have in terms of healthcare disparities. We also look at the data from EPIC, electronic medical record.
Thank you. Yes, thank you so much. So I think we have now the next an update from the Equity and Access Council. Natalia and Nicola. No, Natalia is not here. Nicola is here.
I'll be presenting. Natalia sent her apologies. She wasn't able to make it, so I'll be presenting for that inclusion group. So we can go to the next slide, please. So this is just to give us an overview, just a reminder of the 4 work groups of the Equity and Access Council. We have the Workforce Diversity Group, the Workplace Inclusion Group, Equity of Care, and Monitoring and Evaluation. And this morning, we'll be hearing a presentation, an update from the Workplace Inclusion Group today. Next slide, please. So, we have 13 workplace inclusion groups. And today we'll be hearing from the African American and the Caribbean American Inclusion Group. And we have the co-chairs of the groups are joining us today. We have Christy Davis, who is our Director of Clinical Support at Bellevue, and Dion Durant, who's our Associate Director of Social Work and of the Maternal Medical Home at King's. And they will be guiding us through an update of what's been happening in the African American and the Caribbean American work group. I'll turn it over to you.
Good morning, everyone. Thank you for including us in today's meeting. So the inclusion group purpose, the African American and Caribbean American Inclusion Group will develop programming to bridge the gap between what unites the African American and Caribbean American groups internal and external to the New York City Health and Hospitals health system while educating on diverse heritage and cultures. In addition, the inclusion group will help to educate the health system on the value of these ethnic groups to the productivity and longevity of the health system. Education will be for the edification of group members, the health system, and the community that we serve, remembering that we are whom we serve. Education will also express the celebration of our cultures, acknowledgement of our differences, openness to learn from each other, and express what we welcome collaboration.
Good morning. So we launched our group, I would say in August of last year. So our first event was the African American Day Parade, and that's how we launched. So we just included a couple of pictures. That was myself and Dion. And we had staff from Harlem Hospital. We had a couple of elected members, our police commissioner. We marched with Girl Trek, and it was a wonderful day for everyone.
So when we started, we said that we needed to look at some data as far as the staffing of health and hospitals in regards to the African American and Caribbean American community. What we know is a large percent of staff members employed by New York City Health and Hospitals identify as African American or Caribbean American. And we also know that several of the hospitals within our health system are in communities of color or mixed cultural populations and service members of the African American and Caribbean American communities, thus identifying that we are who we serve. We also dug a little deeper and looked at the 2018 New York City Department of Health Community Health Profiles. In Brownsville, Brooklyn, the rate of expectant mothers receiving late or no prenatal care is higher than citywide rate. 1 in 8 births to Brownsville residents is preterm. Morris Park and Bronxdale's adult obesity rate is 32%, which is higher than the rest of New York City. In Central Harlem, the infant mortality rate is higher than the citywide rate. In all of these communities, we have a health and hospital facility. Whether it's Gotham, Jacoby, or Harlem, we are identified in those populations.
So we have some activities planned. Educational workshops where we'll go over topics that will express our diverse cultures and include health disparities affecting our communities. We are planning a day of solidarity to explore the concept of solidarity in context with the inclusion group. We also will have a multicultural day. Now, we're trying to make sure that it is hopefully in the month of June. It'll coincide with the National Caribbean American Heritage Month, as well as Juneteenth. So we are looking to plan a day of solidarity, and it will be virtual as well as in person. Some dates to consider. We just passed through Black History Month. In June, we have National Caribbean American Heritage Month. In August, it's the International Day of Remembrance of the Slave Trade and its abolition. In September, there's a West Indian Day Parade, which coincides with Labor Day, as well as the African American Day Parade, which is also in September.
And when we discussed and explored workshop topics, we thought about what are our differences versus what unites us between those two groups. Inclusion journey as an African American or Caribbean American. the topic of privilege for any race, first generation immigrant, how that looks as far as navigating the New York City system. And what's not here is that we also looked at highlighting health and hospital staff that are doing big things in the hospital system because we thought that was very relevant.
Okay, and so for Black History Month, we kicked off our three-part workshop series with Miss Ruth D. Hunt in assisting folks in finding their roots. And so the first workshop was held on February 23rd. We had 104 registered, 51 attended. So for the second workshop that just happened a couple of weeks ago on March 16th, we had 200 registered and 138 folks attended. This was open to both employees and external participants if they wanted to. We have one more date, which is April 20th. Please join us if possible. We've received a lot of great response about this, and everyone is trying to get in. So we may up the number of registrants for the last workshop, but it's been very, very successful, widely successful.
So our indicators of success, number of activities scheduled and completed, pre-post tests, attendance, publicity in the Insider. As far as workshops, overall assessment of the workshop, time well spent, how will the attendees use the information discussed? The length of the workshop, was the length of the workshop adequate? We want to assess the speaker's knowledge of the workshop subject, assess the speaker's ability to relay the subject matter, assess location, if in person, and what was most appreciated. Next slide.
Oh, yeah, that's us. We made it to the Insider page. That's big time. So.
That was our first achievement. Our very first achievement. We're very proud of it. Thank you very much for your time.
Any questions?
Thank you so much. Let me just ask the members.
I love the picture. Beautiful.
Thank you.
Any questions?
Yeah.
I have a couple of questions, and again, thank you everybody, Dr. Davis and everyone for presenting. You mentioned in passing Juneteenth. Are you planning to do a workshop? Because I found from talking to some colleagues that Juneteenth seems to be kind of new for some people because it became now kind of a national holiday and a state holiday. And seems to be a lack of understanding from different groups of what it means and the significance. But I don't know if we are doing anything to educate everybody about it, but I don't know what your thoughts.
We absolutely want to hone in on the meaning of Juneteenth. So that's why June is going to be, really important to us, given that it's already after the Caribbean American. So we'll tie in Juneteenth. So yes, we'd like to do an educational workshop of some sort. We have to meet with our group. We try to let them have input on what they'd like to see. So
definitely, I think that
speakers that we earmarked from academia that can probably be eloquent in that area.
Yeah, I think that will be good, definitely. And the other one that, again, a little bit of lack of understanding is Kwanzaa, which I also see a little bit of. So I don't know if that's something that you also are looking at, or
we'll take that from you. We hadn't looked at Kwanzaa, but absolutely, we can.
Yeah, it's just I think your emphasis on educating and ensuring that everybody appreciates everybody's culture, and again, everybody has a different take on those issues. And last, I think maybe I don't know if it will be for your group of Dr. Davis in terms of the indicator of success. There was something that you mentioned that I thought was very important, is to kind of bring the community closer and understanding and valuing our contributions, our differences, but also our similarities, because we do have a lot of similarities. And in terms of the indicator of success, which I think is very good measurements, in terms of the activities, but have we thought of looking and connecting perhaps to what it happens in HR in reports of um, potential kind of misunderstanding between either among staff or staff and patients or among patients from a cultural perspective or complaints that we have received of treatments and all that, and how we look at these educational workshops and looking like the before and after, have we seen any change on the number of complaints because our community has gained more appreciation, more understanding, and as such, hopefully those type of potentially negative interactions may not occur. But I don't know if the data will be enough. But I think it will be good to look at not only how many people attend, but how many take home what they learn and apply in the day-to-day activities, interactions among colleagues, patients, and the like.
So, we always track, of course, the training that we give any of our employees. But in terms of like patient complaints, and when it comes to the category of either patient complaints or under compliance, when it comes to certain categories, we try to work with those partners with patient relations and compliance, for example, and EEO, to see if we can glean information that can help guide future training as well. Of course, it's hard to pinpoint an individual who had a direct complaint unless we have like a direct name associated with it. And then we're able to tell whether or not their performance has changed, whether or not they've had future complaints, whether or not they're repetitive. And then, of course, we kick in other avenues, whether it's retraining, whether it's looking at disciplinary action. In all cases, we try and practice just culture in order to make sure that we are teaching and that we're educating, because it does affect our community and it affects our patients. So we're trying to be mindful of that. But we try to look at everything and then see if we can glean information from it. And that help guides future trainings that we suggest, like unconscious biasness.
I think this is wonderful. I was thinking a little bit less on individual, but more collective.
Yes.
Like if the number, I know you have presented, but I don't remember all the numbers. But like, for example, if there were certain number of incidents and after, we have formed this group, they are so active and all that, we see a kind of a lowering overall numbers of those type of incidents or complaints. I was thinking more at the macro level instead of just
We
individual.
can certainly look at it that way. Now that we have more of a year or
Yeah.
two under our belt with this, we can look at it differently.
Yeah, I think that may be interesting, and maybe Dr. Davis, that may be something that, what I'm thinking of, the indicator of success is a lot easier to measure inputs. That means how many people come to the training, but looking at impact is very hard, and I do understand it. But I think we want to get to that because at the end of the day, what we want is our community to be, very, very inclusive, welcoming, respectful. And I think all this training, this type of showing off in the different publications, the celebration of the accomplishment, hopefully will help that culture. And I know that we have some tracing populations, like for example, we have a lot of the traveling nurses that I don't know how much they take this training. And so I think it will be I will be curious to know that impact measurement, not just the counting the number of that attend the
I
events.
think that's a great suggestion.
Thank you. Anybody else? Any other questions? No? So thank you. And with that, any old business? Any new business? There being no further discussion, meeting adjourned.
Thank you.